Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Pathogenesis of gonorrhea. We already know gonorrhea is a venereal disease caused by bacteria Neisseria gonorrhoeae. Before watching this video, first I will recommend you guys to watch my previous video on biology of Neisseria gonorrhoeae for a clear understanding. This bacteria has a predilection for non-ciliated, cuboidal and columnar epithelium. Remember, non-ciliated. Urethra of male and endocervix of female is lined by columnar epithelium, to which this bacteria has predilection for. Hence, this infection initially manifests as pyogenic infection of urethra in males in the form of urethritis and endocervix of females in the form of cervicitis. Coming to incubation period of gonorrhea is 1 to 14 days. What is meant by incubation period? It is the time period between the entry of organism into a host and development of signs and symptoms of a disease. The events which happens in this incubation period is nothing but pathogenesis. What causes the disease is etiology. Is it capable of causing disease determines its pathogenicity. How it causes a disease is pathogenesis. We will see pathogenesis now. First, entry into the host or exposure of the host to the causative agent. Routes of transmission, primarily through sexual route, that is by direct human to human contact, as humans are the only natural host. Between the mucosal membranes of urogenital tract, oropharynx, anal tract. When these mucosal surfaces comes into contact with each other, infected mucosa will transmit the causative agent to the uninfected mucosa. In men having sex with men, oropharyngeal gonorrhea and anal gonorrhea are common. Perinatal transmission from mother to baby during vaginal delivery. Conjunctiva comes into contact with infected urogenital tract of the mother, leading to ophthalmia neonatorum in babies. Transplacental route and during C-section transmission is not possible. Non-sexual route through fomites means non-living objects like doorknobs, toilet seats, sharing of towels, these and all won't cause this gonorrhea, and droplet spread is also rare. Auto-inoculation by fingers into eyes in adults may lead to conjunctivitis. This is also very rare. After entry of bacteria onto the mucosal surface, then it adheres or attaches to the epithelial cells initially by pili. Then outer membrane proteins, opacity proteins, porin protein, lipooligosaccharides, all these facilitates an intimate adhesion. After exposure, if we pass urine immediately, it won't flush out the bacteria along with urine. Why? Because it will have already attached by means of pili to the epithelial cells immediately after exposure. So there is no use of passage of urine immediately. And then outer membrane proteins facilitates even more intimate adhesion. Why? To enter into the cells, that is nothing but invasion. First intimacy between humans leads to transfer of bacteria onto the mucosal surface. Second, intimate adhesion between bacteria and the epithelial cell leads to its entry inside the epithelial cell. That is nothing but invasion. Simultaneously, lipooligosaccharide, which is having endotoxic activity, lipid moiety A, inhibits ciliary motility and also damages proximate ciliated cells. Why it don't like cilia? It has predilection to non-ciliated columnar and cuboidal epithelium. So this lipooligosaccharide damages the proximate ciliated cells, leading to its further virulence. Coming to invasion. By transcytosis. What is meant by transcytosis? Entry into the organism at one end and exit of the organism at the other end of the cell by means of endocytosis at the apical end and exocytosis at the basal end. Bacteria is enfolded by pseudopods and pinocytosed. This is the mechanism of endocytosis by epithelial and endothelial cells, nothing but pinocytosis by epithelial cells, where it divides and multiplies intracellularly. When it is intracellular, it is resistant to immune attack. This invasion is also mediated by outer membrane proteins. Already I told you here, outer membrane proteins facilitates an intimate adhesion and subsequent invasion. Same outer membrane proteins also helps in evasion. Evasion means escaping from the immune attack of the host. How? Lipooligosaccharides by means of sialylation, pili and OPA proteins by means of antigenic variation, reduction modifiable protein by immune interference, porin proteins by apoptosis of immune cells, IgA1 protease by damaging secretory IgA antibodies. All these mechanisms I have explained on my YouTube video on biology of gonorrhea. Next, epithelial cell damage by release of enzymes like phospholipase, peptidase, and also by lipooligosaccharides and peptidoglycans. Both of these have endotoxic activity leading to epithelial cell damage. Then the bacteria are exocytosed. Already I told you invasion is by transcytosis into the submucosal region, where they elicit a severe neutrophilic response and form microabscesses, followed by exudation of purulent material into the lumen of the infected organ, leading to local inflammation. If the infected organ is urethra, it will lead to urethritis. If it is cervix, it will lead to cervicitis. This exudation of purulent material will be in the form of a flow of seed. Hence, it is given the name gonorrhea. Gono means seed, rhea means flow, ultimately resulting in symptoms, nothing but disease. So, pathogenesis from entry to causation of disease have finished. But all the patients who are infected with Neisseria gonorrhoeae won't develop symptoms after incubation period. 50 to 80% of females, 2 to 10% of males remains asymptomatic. They won't produce any symptoms of disease and form a reservoir of infection which effectively can be transmitted as well as progress into severe complications. From these asymptomatic carriers, mostly transmission of the disease will occur, mainly females. If the inflammation is prolonged without treatment. It will lead to proliferation of epithelial cells in the form of stratified epithelial layers. Ultimately, keratinization and fibrosis occurs, resulting in scarring and strictures, local complications. And it may then further lead to infertility. Infection may also spread to upper genital tract. This is called ascending spread of infection. Pelvic inflammatory disease, peritonitis, perihepatitis, Fidge-Hugh-Curtis syndrome. Nothing but parenchyma of the liver will be normal. Capsule of the liver called Glisson's capsule will be inflamed and get adhesions with the peritoneal layer of the peritoneum. And infection may also spread into bloodstream. Nothing but disseminated gonococcal infection affecting skin and joints is also known as dermatitis arthritis syndrome. Remember the channel name, The Average Derma Doc. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.